with a larger group of actors, the Measuring Separation in Emergencies project. To kick us off, we will hear first from Anna Skeels, who is the project manager of the Measuring Separation in Emergencies project, who will give us an overview. Anna has worked in child participation and child protection over 15 years, both in the United Kingdom and overseas in emergency settings. She managed Save the Children's participation unit in Wales from 2004 to 2010, and was also deployed to Save the Children's Zimbabwe, Kenya, and Somalia programs during this period. Between 2010 and 2014, Anna undertook her PhD in refugee studies at the Center for Migration Policy Research at Swansea University, I hope I pronounced that correctly, and conducted her research in refugee settlements in Uganda. She's also worked on a freelance basis for UNHCR in urban and refugee camp contexts in Jordan, Kenya, and Nepal. So someone who is coming to this project with a wealth of experience and has done an excellent job coordinating a very complex process. Anna has been the program manager of the Measuring Separation in Emergencies project based at Save the Children since the end of 2013, involving the piloting in the DRC and new phases. So over to you, Anna, for an overview of the project before we get to the methods and findings of the pilot phase.
Thanks, Mark. Thank you very much for that introduction. That was very kind. As Mark says, I'm the manager of the Measuring Separation in Emergencies project. To give you a brief overview, the project is an interagency initiative with its origins in the interagency working group for unaccompanied and separated children and the assessment and measurement task force of the Global Child Protection Working Group. So it's responding to gaps in the measurement of separation identified by a range of practitioners from a range of organisations. The main delivery partners for the project are Save the Children in partnership with Columbia University, and we're funded by OFDA. And we work very closely with interagency advisory panel, which includes Mark from CPC Network, and also people from IRC, UNICEF, UNHCR, and a range of other organisations. The focus of the project is to develop robust practical tools to increase the effective measurement of separation in emergencies, responding to gaps identified. In the first phase of the project, we worked with Columbia University to develop two tools, a population-based estimation tool, giving us a snapshot of the prevalence of separation and the basic characteristics of unaccompanied and separated children, and then a community-based surveillance tool measuring and monitoring changes in trends in separation across a network of sites over time. And you're going to hear much more detail on both of those tools in the webinar from the two presenters. Both of those tools were piloted last year in the Democratic Republic of Congo, and that's going to be the focus of discussion today. We also worked in the first phase with Johns Hopkins University on a projection tool. This may be the subject of a forthcoming CPC Network webinar, but it's something that you could contact me on after this webinar if you have any questions on that tool as well. So just to say, I'm very grateful for the presenters who are going to be sharing information on the work that we did over the past couple of years and the piloting in DRC, and also to the responder, Yvonne Agengo from Save the Children, who's going to kind of reflect on it in relation to her practice in the field. And obviously I'll be here throughout if people have any questions or they want to get in contact with me as a result of the webinar. Thanks very much.
Thank you, Anna, for that excellent overview of the project. And as Anna mentioned, I have had the good luck to serve on this advisory panel, and this is really interesting project in the sense that we have in the child protection world known in emergencies that we need to develop programs for family reunification, reintegration, and other programs for children who have been separated from their families, for unaccompanied children. And yet, until now, we've never known how many we're dealing with and what size and scale of program we need to put in place. And this work is an effort to fill that knowledge gap, and we're trying a number of different tools to do so, and we'll hear about 2 of those today. The format of the webinar will be that we'll have a brief presentation, about 20 minutes, from Beth Rubinstein, whom I'll introduce in a moment. About 5 minutes for clarifying questions from Beth, not a substantive discussion, but for people to have a chance to ask questions about pieces they didn't understand or would like a little bit more detail about. Eva Noble will then present the community surveillance method, and it will be the same process, about 20 minutes of presentation with clarifying questions. Short comments from Yvonne Agengo, who works at Save the Children, about how these methods will be useful in the field as they are developed and refined. And then finally, we'll open up to discussion and questions. I know we've gotten used to 1-hour webinars in our international humanitarian and development worlds, but this one will be slightly longer given that we're presenting 2 methodologies here. So it is being recorded for those of you who are going to have to pop out after the first hour, and will be available on our YouTube channel and website afterwards. If at any point during the webinar you would like to ask questions or comments, you can do that in real time, and we will collate those and bring them back to the presenters. You can use the questions box. You should see that on your control panel, or the chat box would work as well. With no further ado, one final comment that if you are having difficulty with the hearing, there is a sound check button on the control panel that you can click, and it will walk you through a process so that you can adjust your sound settings in case you're having difficulty hearing. With no further ado, then, we will hear from Beth Rubinstein, who is a Senior Research Associate for the CPC Learning Network. Her current focus is leading the implementation of enumeration activities to determine the magnitude and distribution of children outside of family care in Cambodia. And Beth is actually joining us from Cambodia, so it's quite late her time, and she's very gracious to be with us today. Beth holds a Master of Public Health and a Master of Business Administration from Johns Hopkins University, and is currently a PhD student in Columbia University's Department of Epidemiology. Her research interests include child protection, the surveillance of hard-to-reach populations, and evaluation of community-based intervention. She has over 10 years of applied experience in global health and human rights, including the prevention of international child trafficking, health systems equity in Ghana and Rwanda, and HIV treatment access activism in South Africa. Beth also previously served as a Peace Corps volunteer in Madagascar, where she focused on health and nutrition at community level. With no further ado, Beth, over to you.
Thanks, Mark, and thanks, Anna. Welcome, everyone. As others have explained, this study focuses on a pilot to develop methods to measure unaccompanied and separated children in emergencies. For the purpose of this study, we defined unaccompanied and separated children using the definitions in the Interagency Guiding Principles on Unaccompanied and Separated Children. According to these definitions, which many of you might be familiar with, separated children are children who have been separated from both parents or from their previous legal or customary primary caregiver, but not necessarily from other relatives. Separated children, therefore, include children who are under the care of other adult family members. Unaccompanied children, on the other hand, are children who have been separated from both parents and other relatives and are not being cared for by any adult who, by law or custom, is responsible for doing so. So unaccompanied children have no adult caregivers. The reason that we're interested in this group is that separated children in emergencies face a multitude of risks, including threats to their health and well-being. Compared to children who are not separated, these children suffer from higher levels of food insecurity, malnutrition, and infection. They're also more likely to be exploited for labor and sex. And furthermore, separation and lack of social support can have long-term mental health impacts, including chronic stress, anxiety, and depression. The humanitarian community does offer minimum standards to guide organizations in establishing family tracing and reunification programming. However, currently there are no guidelines for quantifying the overall magnitude of separation in an emergency. So as a result, practitioners and policymakers have to assess the scope of separation using generalizations and selective data. So one estimation strategy that's commonly used is often just referred to as the rule of thumb, and that states that unaccompanied and separated children usually comprise about 3 to 5% of the displaced population during emergencies. But this rule of thumb has never been validated, and furthermore, using a one-size-fits-all rule doesn't really make sense given what we know about diverse circumstances in different emergencies. There's also the CPRA toolkit, but that's focused on generating qualitative insights. So ultimately, the lack of rigorous data on the scale and circumstances of separation in emergencies impedes our efforts to fund, to design, and to implement effective programming and policies for the affected populations. The Measuring Separation in Emergencies project was developed to address these gaps. On behalf of the advisory panel that Anna described, researchers from Columbia University developed and piloted a survey tool with the purpose of providing a population-based estimation of the point prevalence and basic characteristics of unaccompanied and separated children in a defined area. That tool is the focus of my presentation today. We also developed and piloted a surveillance tool to capture changes in the frequency and nature of separations over time, which you'll hear more about from Eva in just a bit. To our knowledge, this estimation tool is the first population-based survey to estimate the prevalence of unaccompanied and separated children in an emergency context. The tool was piloted in the Nyiragongo and Goma territories in Nord-Kivu in the Democratic Republic of the Congo during a 3-week period last summer. To give you some context, Nord-Kivu is a region in eastern Congo that has been affected by armed conflict for more than 20 years. Children in the region are regularly separated from their families due to violence, displacement, poverty, and recruitment to armed forces. In late 2012, the M23 militia group attacked the area, overtaking Goma and exacerbating the conditions that lead to separation of children. The primary outcome of interest in our study was the prevalence of unaccompanied and separated children in Nyiragongo and Goma territories in the period since the M23 attack in December 2012. And the secondary outcome of interest was a profile of the characteristics of these children, including things like their age, sex, reasons for separation, and current caregiver. Because unaccompanied and separated children may be living outside of a household, for example, they may be in a residential care institution, on the street, with an armed group, a traditional household survey will miss a segment of the population that we're interested in. So one way we tried to address this concern was by capturing information on 2 distinct populations of children. First, the survey measured arrivals, defined as separated or unaccompanied children who started living in the sampled household at any point following December 2012. And then second, the survey measured departures, defined as children who left the sampled household after December 2012 and were separated from their usual caregiver. Departures could include children living outside of households. Births and deaths were not counted as arrivals or departures for obvious reasons. And while you may want to add the number of departures and arrivals to come up with a total number of separated and unaccompanied children in the area we're talking about, we recommend against doing this for two main reasons. One, respondents don't always know where a departed child ends up. So it could be that the departing child is living in another household within the sampling universe, in which case he or she would already have been counted in the arrivals. And two, it's also possible that the departed child has left the sampling universe altogether. Therefore, we analyze these populations separately, recognizing that separated children arriving in homes may also have actually different characteristics and require different programmatic responses than those that are departing from homes. In terms of sampling, we selected our sample using a two-stage cluster design, which is a standard method for household surveys. We estimated that the study would need 20 clusters of 25 households per cluster to detect a prevalence of separation of 5% or more in a population of about 10,000. We couldn't do a true random selection of clusters due to security limitations. Instead, we randomly selected clusters amongst those that were identified as safe and accessible, which is just part of working in DRC. Then to select households within each cluster, we use systematic random sampling, so household selection within clusters was truly random. Based on key informant interviews and focus group discussions, heads of households or other adults were who we spoke to and counted as the primary respondents. So they are who we interviewed. This is what our questionnaire looked like. The questions were designed to ask about household composition in general before and after the M23 attacks. And we didn't ask about separated children directly. The rationale behind this more indirect approach was to reduce bias in the case that respondents might have an interest in either over or underestimating the true number of unaccompanied and separated children in their household. So in order to construct the household composition, interviewers use cards to represent each household member. This is a photo of what that looked like. Cards were color-coded and arranged according to whether the individual had departed from or arrived into the household after the M23 attacks. And the cards then prompted the interviewer to ask about the sex and age of each household member, his or her relationship to the head of the household, and whether he or she was still alive. When the children who had arrived or departed since the emergency were identified, the interviewer then asked additional questions about these children to determine the reason for the separation and also to find out who that child's current caregiver is. So now on to the findings. We surveyed 522 households in total, including 414 households in villages and 108 households in camps. The mean household size at the time that we collected data was about 6 people, including 4 children. And the mean age of the respondents was just shy of 40 years old. On average, households in villages had been living in their current location for almost 18 years, while households in camps had been living in their current location for just 2 years. In the sample of all 2,197 children living in the respondent's home at the time of data collection, 8.5% were separated children who had newly arrived in the household since the M23 attacks in December 2012. Of all the children in the sampled households after the attacks, 1.87% were unaccompanied. Then in the sample of all 2,034 children living in the respondent's home prior to the M23 attack, 5.31% of the children had departed from the households, resulting in separation. And of all children in the sampled households before the attacks, about 0.5% became unaccompanied through departure. Importantly, for almost a quarter of the 108 children who departed, their care status at the time of data collection wasn't known or wasn't reported. So many of these children with unknown care status are likely unaccompanied, but it wasn't possible to verify this from our data. So overall, we see that a greater proportion of unaccompanied and separated children have arrived than have departed. And this pattern is particularly pronounced in villages, but in camps, the pattern's actually reversed with a much larger proportion of departures. In terms of characteristics of the children, we found that the characteristics of arrivals and departures did diverge in a few striking ways. First, a much larger proportion of arrivals were very young compared to departures. And most arrivals were at least partially related to the death of parents or family members and were therefore unintentional. In contrast, for the departures included a higher proportion of older children who are 15 to 17 years old. And in many situations, the departure was reportedly part of a deliberate decision-making process. So as I said, most arrivals were at least partially related to the death of parents or family members. For departures, on the other hand, many factors appear to cause the departure decision, including food insecurity, poverty, and escape. Death of parents or family members does sometimes play a role in departures, but much less frequently than for arrivals. We also looked at children's caretakers. So for arrivals, 3/4 of the arrivals had some type of family relationship to the head of the household where they arrived. For departures, we looked at both current and previous caregivers. Regarding previous caregivers, which isn't shown here, slightly more than half of the children who were separated through departures were not the biological children of the households where they were departing from, which could suggest non-biological children are more vulnerable to separation than biological children. And again, the current caregiver was unknown for a quarter of the departures. So the head of the household in the house where the child was previously living doesn't know what happened to these children. So in addition to surveying the 522 primary households that I just described, we also asked the respondents in the primary household to tell us about the households of 2 of their closest neighbors. And this is a technique that's known as the neighborhood method. The purpose of the neighborhood method is to increase the sample size in an efficient way. So it's been used successfully to measure violence in emergencies, and we wanted to explore whether the neighborhood method would work to measure unaccompanied and separated children. To evaluate the neighborhood method, we disaggregated our findings by primary respondents and by neighbors. If primary respondents were giving us valid and reliable reports about themselves and their neighbors, we would expect the findings from the neighbors' households to be very similar to the findings from the primary household. So we performed statistical tests to quantify the probability that the findings were equal across groups, and we found that differences were actually statistically significant for most values compared. So this indicates that we were not getting valid and reliable information about neighbors. Specifically, primary respondents tended to report about 1 less person in their neighbor's household compared to their own, And there was also a trend towards lower separation prevalence among neighbors' households compared to primary households. And that's what's shown here. It is plausible that respondents might not be aware of the detailed composition of their neighbors' households, or that they became fatigued by the entire interview process and thus underreported about their neighbors simply in an effort just to finish the interview as quickly as possible. In addition to our mean survey sample, we also selected a subsample of 44 neighbor pairs, and we did this to more directly assess how reliable the respondents' reports about their neighbors were. And the way we performed this test was that one respondent from each household within the pair was asked to provide information about their own household and also the household of their neighbor. Then we used a kappa statistic to calculate the level of agreement within pairs, both ways, reporting on the same household. The kappa statistic is used to measure agreement that's beyond what we would expect by chance alone. So overall, the results suggest fair to moderate agreement between households and their neighbors for most variables. However, there was definitely less agreement on household size before the emergency, and the number of children living in the household before the emergency, as well as the number of departures. So these specific variables had less agreement than others. And that may indicate that respondents' knowledge of their neighbors' historical composition is more limited than respondents' knowledge of their neighbors' current composition. This would be an important consideration, especially in light of the fact that we used a very long recall period for this study. So despite generating many new insights for programming and methodological advancement, of course, the study also had its limitations. First, we weren't able to use probability proportionate to size sampling, which would have been the random selection of clusters, because of security restrictions and accessibility to some villages. As a result, the findings can't be considered representative of Nyiragongo and Goma territories as a whole. Second, the long survey recall period may have limited the precision of the findings. The M23 takeover was definitely the most universally recognizable reference point for our respondents. However, this had happened 18 months before data collection, so it's entirely possible that some of the reported separations were not connected to the M23 takeover, and measurement of separation would likely be more precise if it was undertaken very soon after an acute onset emergency. Finally, the method systematically underestimated the prevalence of unaccompanied children due to the fact that all of the respondents had to be at least 18 years of age. So this excluded child-headed households by design. And while information on the caretaker of departed children was intended to partially compensate for the exclusion of child-headed households, respondents often didn't know who was caring for departed children, which is a point I brought up before. So this missing data prevented us from coming up with a true estimation of unaccompaniment even amongst the departures. We also missed a few other categories of children that are listed here, but we don't estimate that these other categories are particularly large in the setting where we were working. So our long-term hope is that these types of estimations will become a standardized part of humanitarian response, but before that can happen, the tools need to continue to be refined. So we're currently planning for a second pilot in a recent acute onset emergency, and we're modifying our methods based on the learning from Congo. In addition to selecting an acute onset emergency for the pilot, we also plan to modify the neighborhood method to just one neighbor, which we hope will address some of the respondent fatigue. If it's contextually appropriate, we want to restrict adult respondents to females to see if they might have unique insights into household composition compared to males. And we'd also like to power the study so that we have a much larger sample for camps. In the DRC, our camp sample was too small to provide robust comparisons between camps and villages. And to address the undercount of unaccompanied children, we are going to record the number of children in child-headed households without interviewing them, since there are ethical constraints against interviewing children under 18. We're also going to develop a separate but related tool for estimating arrivals and departures within residential care institutions. And we're planning on doing all data collection electronically using tablets or smartphones. So that's all for me for the the estimation tool. And with that, I'm going to hand off to Eva to talk about surveillance.
Thank you very much, Beth. Before we get to the second tool and presentation, I wanted to give the attendees the opportunity to ask clarifying questions. You can either raise your hand if you see that option on your control panel, or type it into the chat box. These are simply questions to things you might not have understood from the presentation for a few minutes. We will also at the end have a large have a larger discussion. I do see a question coming in from Roberta Caccetti, although I'm not seeing the question itself. Courtney, if you are on, there we go. Why were children excluded as respondents? That's a design question, so I think it works well in this component.
Part of interviewing any respondent involves a consent process, and the way that consent is defined, if you are a minor, you need to have an adult guardian also provide consent, and then the child who is under 18 only provides assent. So by definition, a child-headed household wouldn't have an adult guardian who can consent on their behalf. And the reason that that stipulation is built into the consent process is that there are concerns that children under 18 may not have the capacity to fully understand the consent process and understand the risks of participating in research. It's something that we are very open to exploring more, but the standard way that the consent process exists, if you are participating in a research survey, there are a lot of limitations in place for protections in place for children under 18.
And this is something beyond this clarifying question I would like us to revisit in the discussion at the end, because this is something that the advisory panel to the study has really struggled with. Finally, we do have a couple of other clarifying questions that have come in from Christine Jonason. I hope I pronounced your name correctly. Would you mind explaining in more detail the cards that were used to identify members of the household during the survey? Who filled out those cards, and how did you get respondents to mention children who had departed? That's the first of two more. The second is, when will the research on children in residential care roll out? Will this also happen in the Democratic Republic of Congo?
Great. So the first question about how we have the cards work, Eva, feel free to chime in since I was not on the ground collecting data, but the enumerator, or the data collectors, were trained to ask the households to tell us all members that currently live in their house. So just a basic construction of everyone in their house, and then to tell us everyone that lived in the household at a point before the emergency, and those two constructions were compared. And that's how we were able to capture departed children. So when there was discrepancies, in their construction of households before the emergency, if there had been more children and now there were less, we said, oh, what happened to that child that used to be here? And so hence we were able to indirectly kind of get at the construct of departures. And same for arrivals. If the current household had new members that weren't part of the household at the time of the attacks, then again, that prompted the data collector to ask more details. Does that make sense?
I thought it did, but if the person who asked it doesn't think so, they can chime in. She says yes,
Sure.
Thank you.
And then the second question.
Sorry, yep, go ahead.
The second part was, I guess, about whether we'll be doing this in DRC for the second pilot. And the answer is no, unless, the plan is to pilot in a different context because we want to eventually make sure that these tools are somewhat universal and that could be applied in a variety of contexts.
Yes, we have another question related to the participation. Children and youth who are able to respond and give consent without their caregiver. Was this issue considered? And I do want to bounce this over to the study's principal investigator, who's also on the webinar and here to support questions and would like to respond to the question about child participation in this pilot, knowing that it is something that the broader project is still considering. Lindsay Stark, Director of the CPC Learning Network and Principal Investigator on these studies, over to you.
Thanks, Mark, and hi, everybody. I just wanted to add to, the good thoughts that Beth has provided. I think one of the things that we talk a lot about in terms of measurement and assessment in the humanitarian community is the appropriateness of actually interviewing children in, for example, an acute onset emergency right at the beginning, and what the potential ethical implications are for that and how we make sure that the appropriate supports can be provided to children if anything upsetting occurs as a part of the discussion. So really a part of this study was to see if adults are actually as knowledgeable as children about separation and whether we could actually avoid potential ethical implications of directly interviewing children moving forward, and finding other ways potentially to engage them through supported qualitative means if necessary. So that's just the main thing that I wanted to add.
Thanks, Lindsay. Two more questions, both of which I do think are clarifying, and we'll then move on to the second presentation. Can you indicate, this is from Monica Ruiz Cazares, can you please indicate what method, EPI, was used to randomly select households at the second stage? And from Bashir Saeed Hassan, please explain why you I think maybe highlight the percentage as a reason for separation for children. Maybe please explain why there is a high percentage as a reason for separation for children whose parents or caregivers have died. How did this contribute to the separation?
Great. Eva, do you want to go into the household selection process? Are you on?
I am on. So in the first stage, we were simply given a list of safe and accessible locations in the territory that we were working in, and we were given, I believe, population estimates from the health unit of Save the Children. So we're doing sampling proportionate to population size. And then, so the first set was sampling proportionate population size to come up with a randomly selected set of 30 clusters that we could go to safely and we could access. And then once we got to the villages, the second stage, we did sort of a tour of the village to get the layout of a map. We drew maps of how the villages were set up and counted approximately how many houses there were. and then using a random selection, we continued to divide that section down until we were at a sample of about 150 households. And then we used a random number generator to come up with which household would be our starting household for that sampling interval.
Thanks, Eva.
Back to you.
Right. And the question about the contribution to separation of children whose parents or caregivers have died?
So, I mean, we didn't assess directly if their caregiver had, you're asking, I guess we did ask reason for separation, so that included children who are separated because their caregivers had died. Sorry, is the question if that would have sort of inflated our numbers more than would be expected? Is that?
I don't quite understand. Maybe, Bashir, if you could rephrase the question, and we'll come back to it at the end. I think, but I'm not sure. The question is, why was the percentage of children who are separated because of their parents' death high? But I'm not quite sure.
Okay. Yeah, I mean, in that case, I think just the pervasive violence and fighting in this area of the Congo, I think, contributes.
Yes, why was the percentage high? Great.
Yeah, there's just a high adult mortality rate in the Congo, and that puts a lot of children at risk of losing their parents.
Yeah. One final one, and then we will move on. Thanks. This is from Samuel Munuwini. What are the standard key variables to measure the well-being of children in separation? Can they be universal?
Can I jump in on this one?
Yeah.
Sure, Lindsay.
For this one, I would refer Samuel to a wonderful resource on the CPC website that Alistair Ager and others have co-authored, looking at a variety of measures of well-being that have been used in emergency settings and sort of evaluating across different contexts and looking at core indicators. So I think that is going to give Samuel more information than he ever dreamed on the subject.
Great, thank you. Moving on to another tool. Thank you very much, Beth, and to all of you for asking questions to clarify how this process worked and what it found. We also, in this process, designed another method that's measuring separation in a different way, a community surveillance tool that will be presented here by Eva Noble. Eva Noble has worked for the past 5 years with international and local NGOs and academic research teams on topics including emergency child protection, education, and the scale-up of HIV services for vulnerable populations. She received her Master of Public Health from Columbia University. She worked with the CPC Learning Network for the last 1.5 years and was a member of the Measuring Separation in Emergencies field team in the Congo last year. She's currently a research officer at the IRC, the International Rescue Committee. Eva, over to you.
Thank you very much. So both Beth and Anna mentioned at the beginning there were 3 components to the Measuring Separation in Emergencies project. I will now be talking about the second component undertaken by the Columbia University team, which is the surveillance tool used to capture changes in the frequency and nature of separations over time. Like the population-based estimation tool that Beth has just discussed, this is the first known effort, or that we know of, to set up a community-based surveillance system to capture unaccompanied and separated children in an emergency setting. So going back briefly to that information gap that Beth highlighted, a community-based surveillance system would be able to provide continuous and nuanced reports from hard-to-access locations to inform better provision of services and to adapt to changing needs. It also would help in determining when alternative and more intensive measurement strategies would be needed to elucidate current conditions. So community-based surveillance refers to the ongoing and systematic collection of data at the community level, often using community members themselves as informants. Such systems have been used in resource-poor settings, including emergencies, to actively collect information and monitor trends on a broad range of topics, including nutrition, polio, maternal health, malaria, drug resistance, and all-cause mortality. The objective of our community-based surveillance system was to test the feasibility of setting up a system capable of continuous and ongoing measurement of trends and basic characteristics of unaccompanied and separated children in predefined areas in Nord-Kivu, DRC. We aimed to develop and implement a safe, cost-efficient, and community-driven mechanism to provide this real-time continuous data. This was a SMS-based surveillance system. We chose this method to keep it small budget, low tech, and with an easy reporting protocol that aligned with current norms in the area. One clarifying note on mobile phone-based surveillance systems, as they are becoming more and more common for a wide array of topics, there are two types. There's crowd-seeding and crowdsourcing systems. In a crowdsourcing system, anyone can send information to a central aggregator. Examples of crowdsourcing include Women Under Siege, which collects information on sexual violence in crises, most recently publicized in Syria, and many Ushahidi mapping systems. Because anyone can send in information, some questions arise about the reliability of the reported information. And there is no control geographically where the reports come from, so they may all cluster from one place, whether that really is saying that place has a higher amount of incidents or not. In a crowd seeding system, only chosen participants can send reports. Therefore, you can set it up so data is received from representative sets of areas. All senders to the system are known and trained, can be contacted for follow-up questions, and have longer-term relationships with the project. And internal validation is possible if you have more than one person reporting in the same area. A downside of these systems is the security of chosen reporters, depending on the sensitive nature of the reports and who knows about their role as a reporter. An example of a crowd seeding project is Voix de Kivu's, a system in Eastern Congo that used cell phones and appointed reporters to obtain high-quality, verifiable, and real-time information about a wide range of emergency events taking place in areas that the research team could not access. Our system is a crowd seeding system based off the Voix de Kivu's model, where selected community focal points could text in their assigned geographic area. The implementation plan for our community-based surveillance system involved establishing 10 clusters, selecting 3 focal points per cluster, providing training in mobile phones for each focal point, following the system along for 2 to 3 months with on-the-ground support from a local project coordinator, and conducting verification visits at midpoint and a final evaluation at the end. Our 10 clusters to seed the system were chosen from the randomly selected sample of villages visited during the survey. In each village, we consulted with the village chief to share the project and seek his approval. With that established, we introduced the project to the village through impromptu meetings that were open to anyone and everyone. We explained the role of community focal point as follows. They would be community members responsible for reporting on child separation in a pre-identified geographic zone in real time. This zone would either be the entire village for villages of 150 households or less, or a selection of the village about 100 to 150 households large. These focal points were not responsible for coordinating response or services to the cases. Instead, they were acting as the eyes and ears of the community. We had the following selection criteria in each village. 3 focal points in total, the first of which was the village chief if he was willing and able. The second was a selected or elected member of the community. And the third was a representative of a youth group, a women's group, or a Recoupé member. A Recoupé is a village-level child welfare committee that has been facilitated by international NGOs. To ensure that women were also selected to see whether they would also be strong reporters, we mandated that one of the 3 focal points was female in each village. We selected these 3 types of focal points to see who in the community would be the best reporter. We also felt that we needed the chief participation to allow others to fulfill their roles, and we wanted to see if they could be reliable sources of information in this matter. In the selection process, we encouraged as democratic a process as possible in these community meetings. This photo shows a wonderful and rather speedy community meeting in which the selection process followed as such. Candidates were nominated from the crowd. In this case, it was the man in the blue coat and the red shirt, and meeting attendees were asked to line up behind their choice. It took maybe 3 or 4 minutes for them to end up with their selected focal point, who was the man on the right in the red shirt. We ended up with 31 community focal points total, as one village could not choose between 4 candidates. So 10 were village chiefs, 13 were community selections, 8 were representatives of women's, youth, or child welfare groups, and 9 of our total 31 were women. Once the focal points were selected, they received a 2-day training on important definitions and cases to be reported. This included their geographic boundaries, either the village or a predefined section of their village, and temporal boundaries, only cases that happened during the course of the pilot and not before. They learned texting procedures and coding of unaccompanied and separated children characteristics that we were looking for. And here they were given their cell phone, credit, an instruction manual, and a codebook for reporting. This codebook provided 6 steps of reporting to provide this to be sent to the central project phone and the person who held it, who is the project coordinator, with key information about the separated child. This was the age, the gender, whether they were separated or unaccompanied, whether that child was arriving in the community or departing, the reasons for separation, of which they could choose multiple, and the current caretaker. Again, they could choose multiple. Each step was these 2-digit codes to end up with a message made of 6 components. For example, a text message could look like 94, 20, 31, 40, 54, 55, 71, which would correspond with a child who's 0 to 4 years old, who is a female, who is unaccompanied, who departed from their community, whose reasons of separation were cited as poverty and running away, and who is currently being cared for by an aunt, uncle, or a grandparent. Each week, the community focal points reported any new cases in their village or their selected zone. If there were no cases, they were asked to send 000 to report no new cases that week, referred to as null reports. If they had problems, they could also text 9999 to receive a phone call from the project coordinator in the next couple of days, but if there was anything urgent, they could just directly call him. So here's how the system worked. Each focal point had a phone and received a small weekly allowance of phone credit, as well as reimbursement for each text message that was sent to the project phone. The community focal point was then responsible for sending in the text message in real time when they learned about a case of separation in their reporting area. If by Friday there were no cases, they would send a null report to confirm they were engaged and had nothing to report. The focal points were sending these messages to one central phone, which our local project coordinator kept with him. Our project coordinator was an employee of our wonderful partner organization, PAMI, who has been providing identification, documentation, tracing, and reunification, or IDTR, services for unaccompanied and separated children for more than 8 years in Nord-Kivu. This central phone was a smartphone which was then connected to Frontline SMS, a free open source software that connects phones to a website. Frontline SMS then serves as an inbox for the text messages and phone calls once it's connected to the project phone, and it automatically updates when the program phone has internet. Through this, the Columbia and Save the Children team were able to monitor the system remotely. At the same time, the project coordinator on the ground followed up each case reported with a phone call. He asked questions to establish if this was a true case of separation in the right time frame and the right geographic zone, and so, if so, he then asked a set of follow-up questions, including whether the case was intentional or unintentional. This detailed information about the case was then sent both to the Columbia and Save team and to PAMI field agents for connection into IETR services, or Save the Children Goma for additional case support. So this is a quick glimpse at what Frontline SMS looks like as it acts as an inbox for the phone activity. And you can see that like everything there is a text message that's sent in, and we could log in from any location in the world to see what was happening on the phone in almost real time. The website could also map quantities of messages over time, so we could look for trends and see if there were spikes for any reason. That big spike right at the beginning is just the first week that they received the phones and were connected to this central phone, so everybody is sending in a text message. Text messages were then sorted by our project coordinator into categories. There were correct reports, which followed the protocol. There were incorrect reports, which were resent after the discussion with the project coordinator. So if someone was reporting a case, but they used the wrong code, and this was elucidated in the conversation, they were asked to resend the correct code into the system. There were errors, which were incomplete messages or blank messages. And there were cases that occurred prior to the pilot date. These old cases were considered incorrectly reported cases in assessing the system performance, but all cases were followed up by PAMI field agents regardless of when the separation occurred. So how did the system do? We received 349 texts total to the project phone over 11 weeks. This excludes 97 texts from the first week, of which all were old cases or errors. After that, within this 349, there were 21 incorrect messages when the corrections were then resent, 55 cases reported that occurred prior to the pilot timeline, and 57 errors. This left 216 reports per protocol, so case reports, null reports, or assistance requests. Removing duplicates, this led to 62 unique cases of separation, 58 arrivals, and 4 departures. We learned midway through that focal points had misunderstood the definition of departures in training, thinking that we meant children who had been separated, arrived in a new village, and then left again, so as case secondary separation, which explains the low number. So this means that the number of cases of separation that we captured is likely underreported, as these separated children who left the community were not reported for the first 7 weeks of the pilot. Over the 11 weeks, there were, as I mentioned, there were 62 unique and verified cases of separation, and this graph just shows which week the reports came at. There was an average of 5.6 separations reported each week and a range of 1 to 7 cases each week. With the exception of week 8, which is this large spike, the numbers of separated children were pretty roughly evenly distributed between 4 and 10. This large spike in cases in week 8 does not reflect a large increase in unaccompanied and separated children at that time, but that this is when a refresher training session was held and our project coordinator learned many focal points were losing motivation and were just sending in a null report each week to receive their allowance, but they weren't seeking or reporting cases. After that session, so that session occurred in week 8, and after that session, reporting spiked, which is this week 8 peak. Also during these sessions, we learned about the misunderstanding of the definition of departing children. So there were some reports that occurred after that. Due to reasons that Beth mentioned earlier, such as not wanting to potentially double count cases, we aim to analyze the characteristics of arriving and departing children separately. But due to the low number of departures, analysis was not meaningful for those 4 cases. So I'm presenting information on the characteristics of the 58 arriving children. The reported cases of arrived UASC consisted of a slightly larger number of male children. Most of the children, almost 70%, were between 5 to 14 years of age, though there were some younger and older. And one of the most striking findings was this high number of unaccompanied children. More than half of the reported cases from this system were unaccompanied, meaning they are without any family or appointed caregiver. Specifically, there were 43% of these arrivals who were now under the care of someone with whom they had no family relationship at all. 10% did not have an adult caregiver at all, instead lived with other children, which could have included siblings under 18, and grandparents were also caring for a sizable proportion of these children. The majority of children had been under the care of their parents prior to separation. As seen in the survey, which Beth discussed, death or disappearance of parents or family members was by far the most common reason for separation, followed by running away, escaping, or the marriage of a parent or guardian. This last one, the marriage, was especially interesting because we learned that in these cases, parents were often remarrying and leaving their children from a prior marriage or relationship behind or sending them elsewhere. Note that these figures represent the percentage of children for whom a given reason was cited. So in some cases, there were multiple reasons contributing, or in some cases, no reasons were given. So these numbers do not total 100%. And in this system, twice as many reported cases were considered unintentional compared to intentional separations. In 9 cases, the intent was not known. As these numbers do not come from a representative sample, and we did not calculate how many total children there were in these villages, we don't know, and we don't know how many and which children the system missed, we caution that these results cannot be generalized or used for enumeration this time. So how did the system perform? As mentioned, it operated for 11 weeks. Of the 31 focal points, 18 or 58% sent a per protocol message to the central project phone each week. All 62 verified cases of separation come from these 18 focal points who are correctly following study protocol. This graph shows the amount of total correct messages and incorrect messages sent following the basic study protocol. So correct messages were these case reports, null reports, or assistance requests. Incorrect messages were the coding errors, cases that didn't meet the definition of meeting the definition of UASC, or the defined time frame or defined location in the pilot. By the 5th week of this project, most messages that were received were adhering to protocol, as seen here. You can see that the percentage of incorrect messages against the total messages decreased and stayed low after week 5. So all 31 focal points were analyzed to determine whether there were certain characteristics which predicted strong adherence to protocol. The probability of sending a correctly standardized message to the central phone each week was highest among focal points who were elected by their communities, compared to those who were the village chiefs or the group representatives. The probability of correct and consistent reporting was also slightly higher for male focal points, but this was not a statistically significant difference. We also looked at reporting by village and saw that correct and consistent reporting did not vary by villages. So our project coordinator Gustav visited all villages several weeks into the project to learn about the experiences of the focal points, to confirm a sample of cases, and to examine data discrepancies, especially between the same focal points in the same, different focal points in the same village. During these verification visits, the project coordinator met with each focal point individually, as pictured here, to complete a standardized assessment form. He also convened a collective discussion with all of the focal points to see how they were doing and to facilitate sort of a knowledge share and transfer. The feedback received during these meetings was used to improve and strengthen the surveillance reporting process for the remainder of the period. At the close of the project, all focal points from the village from all villages were invited to a final meeting. Here, individual exit interviews and written assessments were conducted. So what we learned from these assessments was that focal points learned about new cases through a variety of approaches. Most commonly reported were active visits to community members' households, reports coming from other community members, their own observations of new or missing children in their village, and overhearing other conversations and asking follow-up questions. Some focal points also reported that they gained information by asking questions to children, by making announcements at church, by enlisting additional community members as volunteers, attending village security meetings, and exchanging information with authority figures. These reporting rates were likely influenced by a host of factors, including the hours of work per week, which was self-reported by the focal points ranging from 2 to 42 hours a week, the respect by the community of the focal point, and whether the focal point had other full-time work for their livelihoods. They were asked, how easy or hard is your role, on a scale from 1 to 10, where 1 is the easiest, and the average score was a 5.5. From these visits and discussions, it became clear that a challenge with this role was that it became larger than originally thought, especially because these focal points sort of became liaisons to the IDTR field agents when they were following up the case reports. Overall, most focal points did not think that their findings fully captured all cases of separation in their communities. They were asked to assess the likelihood that they were learning about all new cases, and they rated their likelihood as about a 6, where 10 was they were very likely to learn everything. Half of the focal points who participated in the final evaluation, which was 29 of the 31, reported that they were very happy with their roles and they felt that the community appreciated them. So to discuss some of the learning points from this pilot. First, the feasibility, which was our original objective. This pilot does suggest that it was feasible to set up a community-based surveillance system that could provide continuous real-time information about trends and basic characteristics in a humanitarian setting. We learned that this type of surveillance system is feasible and can be monitored remotely, but it takes maintenance. It takes community interest, it takes buy-in, and it took on-the-ground support from our project coordinator. The mobile phone infrastructure is still quite underdeveloped in eastern Congo. There's unreliable signals in many villages. Sometimes the service would just go out. Sometimes different networks only work in one specific village. But despite this, no focal points reported any difficulty sending or receiving text messages at least once a week. There is, of course, one caveat to this assessment of the feasibility, which is that this pilot was only 11 weeks long, which is a short period of time. In this system, it wasn't possible to formally assess the comprehensiveness of our surveillance system, but it was possible for us to assess the epidemiologic sensitivity of reported cases, meaning the percent of cases that were captured by our system that were then verified to meet the case definition. So for each new case of separation that was reported, an IDTR field agent was assigned to collect further information and begin the process of strengthening the child's current care situation, locating the family, or finding temporary care. In this process, they confirmed whether the child met our case definition. So our sensitivity here was calculated as the number of cases verified by the project coordinator and confirmed by the IDTR agents over the number of cases verified by the project coordinator. This came out to 56 cases out of our 62 that were reported and confirmed, giving a sensitivity of about 90%. However, because we were very lucky to have a devoted and rather incredible project coordinator, we also wanted to assess the system sensitivity if he wouldn't be there. So the system received a total of 114 coded reports of separation prior to the project coordinator screening and verifying. So if we assess the sensitivity without the step of our project coordinator, the sensitivity did drop to 50%. We were not able to assess the specificity of the system in this pilot, which would have been children in the villages where the system was functioning who are not separated and confirming that they were not separated. So we weren't able to see if we were missing cases. We also wanted to discuss the programmatic cost a bit, as one of our goals was to make sure this was a cost-efficient system. So each phone cost $25 originally, and once the project was up and running, the costs were about $85 a week in terms of reimbursements, allowances, communication costs, and the salary for the project coordinator. This was, again, 31 focal points in 10 villages. So a point about the information on arrivals and departures captured by this system. As mentioned, the focal points did initially misunderstand the case definition of departures, and this wasn't clarified until week 7 or 8. So data collected prior to that did not capture departures. And this is just something to remember in the information that we shared, and a goal for future pilots to clarify that and ensure that reporting procedures are very clear and understood prior to setting it up. And there were some challenges that I want to go into. So the community had very high expectations for this system, and when we met with them, their questions were really around having a larger geographic reach and running it for longer. They saw this as a very important piece of work and had many questions about the small scope of the pilot. I also want to touch on the safety of the focal points, as this is an area where armed groups are active and children could be abducted. It could be very sensitive to talk about unaccompanied and separated children, so we wanted to know the safety of our reporters. 10 out of 29 focal points said they had some security concerns over the course of the pilot. However, these were not due to armed groups, but primarily because they said that the community was jealous of their perceived financial benefits, which, to clarify, they weren't actually receiving. So there also is a challenge with many community-based surveillance systems of the volunteer nature of this work. The data quality is highly dependent on our focal points, and that quality and consistency is limited by the motivation on the part of the focal points, which did decline over time. This issue became particularly apparent when many focal points openly revealed their strategy of reporting no cases by default to get their allowance. This was directly addressed in the refresher training, and case reports did increase. So this is something, as we move forward, to build in these type of trainings and build in active midterm engagement to keep motivation high. Still, the number of reported cases, even after the spike and the reported training, did drop down. So it is important to note that participation remained uneven among focal points. As I mentioned, 18 were reporting each week, so there were 13 that were not. So some were much more active than others. There also were some problems with phones. 4 phones didn't work correctly or had battery issues and needed to be switched out. 2 phones were stolen, and 1 female focal point said that she had her phone confiscated by her husband, so she couldn't participate actively. Cell phone charging costs also were a huge burden to focal points through their reports, though this was resolved at the end by providing solar-powered charging strips to each village, which also served to thank them for their participation. And the last thing I want to touch on is that in this pilot, a strength of the system was its direct linkage to IDTR activities. Participating communities saw tangible results related to their data collection, and they felt that the system served a purpose beyond research. The focal points were valued in their role in facilitating reunifications and service provision for these vulnerable children. And so it was great that PAMI was there to set up and play such an active role in terms of follow-up. This tool was originally envisioned as a more straightforward surveillance tool, and it would be interesting to pilot the approach more in line with the original vision, comparing how well it works and how the community responds. But to be clear on this point, even with a more straightforward surveillance approach, the team would require some partner entity capable of following up on extreme cases identified through the system. So this surveillance system, to conclude, it fills a critical gap in the measurement of separated and unaccompanied children in emergencies. Additional piloting in different contexts is recommended, as there were many challenges and things to discuss. And future iterations should focus on allowing data collection to allow for a longer time, but there are a few other things that we would like to expand on. So first is building in a method to measure the specificity and sensitivity. For example, to capture whether we're missing children in the reports, we could do a small household survey in a few villages and communities to see if all of the unaccompanied and separated children captured from the survey were also reported by the system. We also would like to measure which group performs best as a focal point on 3 points. So consistent reporting, which group is most likely to report each week, precision, which group is most likely to correctly report, and timing, which group is most likely to report the event, to hear about the case and report on it first. We also aim for longer initial training to clarify all definitions and to provide more simulation exercises, and for more and improved refresher trainings throughout the pilot. Future iterations will focus on a longer duration to test the system, to see how it performs over time, and also some increased onboarding time for the program coordinator. So in this pilot, our project coordinator came on during the training process and then took over. And so there are hopes that he can be leading the training and leading the implementation of the system, he or she, in the next iteration. And also using this position to connect this project coordinator, who now is well connected to all these community reporters, connecting it to the broader child protection community in that location. And last, of course, there's still much to learn about how to best motivate community focal points for consistent and even participation. So we wish to explore that. So with that, there are many acknowledgments for this project, for both Beth and for the research that both Beth and I reported on. As Anna mentioned at the beginning, we would like to thank OFDA for funding the project, the Global Child Protection Working Group, and especially the Assessment and Measurement Task Force, the advisory panel for this project, all members of Save the Children UK and GOMA that supported, our partner organization, PAMI, and all of our incredible field staff, which included 14 enumerators, 2 translators, multiple community liaisons, and many other people who supported us. So thank you very much.
Thank you, Eva. Lots of information there, and right there on the screen you can see the website where a lot of documentation about this project is contained. You have 4 clarifying questions. I recognize that we're just 12 minutes out from the end of the webinar, so I would like to get these to you quickly and then give Yvonne a chance to present some thoughts. The first 2 questions are from Rhoda. One of them I think you've covered. What was your definition of youth in terms of age category, and were there planned interventions and programs for the separated children after the date? And I think you've covered that PAMI did this. And 2 questions from Samuel Munyawini. He's noting that there were data. He has worked on similar systems in South Sudan, and the challenge was motivating volunteers to regularly share data. I think you've addressed that, but he's curious how you avoided double counting. And he is also asking about ensuring confidentiality, a question that was repeated by Jessica Busquet. So if you could address the definition of youth in terms of age category, the avoidance of double counting, and confidentiality, that would be great.
All right, I will try to do these very quickly. So the definition of youth that we used was the sort of universal case definition of children, which is anyone under 18. And we broke, let's see if I can find this very quickly, and we looked at them in bins. Oh, so I see the question. So this actually was 15 to 17 years old. I apologize for the typo here. So we had 4 bins, 0 to 4 years old, 5 to 9 years old, 10 to 14 years old, and 15 to 17 years old. And those were the groups of ages that we were looking at and capturing in the system for children. As for double counting, this was, duplicates were sorted out through the process of our project coordinator following up on each case. And so he was able to ask many questions to learn more about the situation, and if it sounded like a case that had been reported by someone else or had already been reported by that focal point, he could probe further. Also remotely, we were able to monitor and see if the text messages coming in were exactly the same and could flag to the project coordinator to see whether it was the same case. And in some communities, the focal points were actively working together, and so they would learn about a case and they would all send the message at the exact same time, the coded message that they had all agreed upon. And so in that case, that became quite apparent quickly, and they told us that that was their process, and so we could quickly verify, is this the same case as this other focal point, and sort duplicates out that way. To ensure confidentiality, this was stressed very much in the training, that this is sensitive information and needed to be kept confidential from our focal points. From all of the research staff, we all have undertook extensive human subjects training and respected all sort of typical research ethical rules around confidentiality. There are no unique identifiers in this system. So though maybe a community member could figure out what child it is if it was a small child from just that coded information, they probably would not have access to the code book, so they may not be able to untangle the text message. And the community focal points were trained and taught in confidentiality definitions and implementation to maintain that and ensure safety for everyone. And if anyone would like to jump in on any of those, please feel free.
Hi, everyone. I am going to move right along to Yvonne. I don't see any more questions, but also think that we should give her enough time to say, to reflect on how this influences practice. This process was undertaken through a research practice collaborative, but it's also, we've heard a lot from the researchers, and we wanted to give some final time to people who use this information to think about how it will change the way that they operate. Yvonne Agengo is a child protection professional with a background in anthropology. She began her humanitarian career working with World Vision Kenya on community-based humanitarian protection, and after that worked with World Vision in Darfur, implementing protection, gender, and childcare programs. She later joined Save the Children United Kingdom to focus on humanitarian child protection. She has been an emergency response personnel there for the past 4 years, supporting their humanitarian response in different contexts, including prevention and response programs for the separation of children in emergencies. Yvonne, thank you, and we look forward to hearing your thoughts on this work.
Thank you, Mark. So I'm just going to give an overview or my thoughts on what the research means for us in the field. And the research is very much welcome, as working with separated children forms one of the core parts of our work. It is one of the, when looking at child protection concerns in emergencies, separation of children is one of the core pillars that we work on. Usually measuring separation is not easy in emergencies. We don't have, across different agencies, we don't have standard tools and means to measure the scale of separation promptly and respond as expected. So looking at some of the tools presented, like the estimation tool and the community surveillance, these tools, the tools from what I see, they're able to help us promptly estimate or to give a good enough knowledge of the situation or the scale of separation at the onset of an emergency. Again, from those who come from the field, you'll understand that at the onset of a crisis, there's always a push to know the ground situation, how many separated children are there, and these numbers are just not to know the numbers, but they guide us in terms of how much resources should we be planning for separated children, or how much should we be fundraising for. So knowing the number and the scale of separation at an early enough stage, using methods that are tested like in the research, is something that is really necessary and important for us in the field. It often becomes difficult to justify why we need the resources, especially human resources, to work with unaccompanied children, when at the beginning of a response, before you get just your teams up and running, train them and get them out to start even identifying separated children, it takes time. So you might find that even after 2 months, that's when 1 month setting your teams up, and the second month you're already beginning to identify unaccompanied separated children. If you have numbers like only 5 children identified, 10 children identified at the onset, then there's a risk that the situation of unaccompanied children will not be taken as seriously as the real situation, and yet the problem is not that there are not enough unaccompanied children for us to focus on that, but is that we do not know, or we don't have tools to help us identify them early enough. So this is really something that is welcome, and looking forward to see how we can start, hopefully finalize the testing and we can start using the tools. Another thing that I would like to comment on is the mass identification of unaccompanied children, which normally happens in emergencies when you want to go out and quick enough already know what is the scale of separation, get our teams out to do mass identification so that we can promptly start tracing, or we can promptly start case management for unaccompanied children. We know this at times can lead to false reporting because, again, at the onset of a crisis, different sectors setting up, and we have teams going out to identify separated children. Of course, community members will wonder what is there to gain or in identifying a child as separated or unaccompanied, or at times we do get false reporting, and I think that's one of the things also that was identified in the research. What is interesting is that in this research presented, the scale of false reporting is very limited compared to is very limited, and it's interesting to see how once the children were identified, this was linked to the project coordinator, and then the field teams were able to go out and do the verification and follow-up of the cases for unaccompanied and separated children. This, I think, is something that will help us very much in directing the time of staff members, because we find that in the field, you have, as an example, a team of 10 people, which is quite huge, or a team of 20, which is, usually you will not have a team of 20 people. So let's say you have a team of 10 people, and you're working, as an example, in a camp, a huge camp, for the team to go out and do identification of separated children and then do the verification process and then start doing their case management. It will take time. It takes a lot of human resource before you do their trainings and get out to do the work with them. So it's very interesting to see the community surveillance system. I think it's something that I find very, very interesting, and hopefully it's something we can, I don't know how soon we can roll out the system so that we can start testing how we can start practically using the community surveillance system. The community members, we know, is our biggest resource. They're consistent, they're there, while staff members may come and go. So this is what the tool, I find that very, very interesting and practical method of using the community members to identify separated children from a perspective that they understand, and then using that to link to the coordinator or with agencies working on separated and unaccompanied children. Some of the limitations discussed, the neighborhood method is just something I'd like to flag very quickly. We normally assume in emergencies that the neighbors normally know about the other individuals in the community. So that's why we do things like informant interviews, which are very, very popular, asking the village leader or doing some random sampling. We always assume in a setting like a village, people know the situation of the others. And so it's very interesting for me to see that the neighborhood method did not give valid data, though that is something that you plan in the phase 2 to slightly change the methodology and see how that will work by using one neighbor instead of 2. Something maybe to think about for the next stage of the research and listening through causes of separation and which children are the most vulnerable is an analysis that often helps us in prioritization, because when working with unaccompanied and separated children, it's not just to know the scale of separation, but what makes them vulnerable. Is it? I see the research has highlighted the causes of separation, and then this is flagged from the community to the agency working with unaccompanied and separated children. Something that we may have to think about is the perception of the community on children who are vulnerable. So as an example, if the community members flag a separated child who, according to the community, is not vulnerable, because and the understanding, because of, for example, harmful traditional practices. So from the community perspective, if an unaccompanied child is at risk of marriage, that is not something the community will flag to the agency, while the agency will see a child at risk of marriage as a case that we need to prioritize for case management. So again, I understand that this was a research focusing on measuring the scale of separation, but then gives us food of thought in terms of linking the community perceptions and vulnerability of the community understanding of vulnerability and agency understanding of vulnerability when we use the community members to help us identify cases of unaccompanied and separated children. I'm noticing the time, and so yeah, just one final point for the future. I think it will be very good to see how these tools link with already existing tools for unaccompanied and separated children. So for example, we have the Child Protection Information Management System, which I think currently is being improved, and also in the refugee setting, the UNHCR database. I think in some settings they're seeing how to work, the two databases can work together, or teams in the field working on with refugee children or non-refugee children can link together. So it would be interesting to see how the tools developed here can develop for this research, can merge or link, can communicate, can talk to each other with the other existing tools that we have in the field for documenting and working with unaccompanied and separated children. That's all from me. Over to you, Mike. Mark.
Thank you so much, Yvonne. Those are very thoughtful considerations and reflections, and I think are the beginning of a much longer conversation about how this work of estimation, of community surveillance, influences, interacts, informs, and revises practice. I would also note, to wrap this webinar up, that it is the webinar of two of the tools that were developed in the first phase of a project. Given the ambitious scale of the work that we're trying to do here through the Measuring Separation and Emergencies project, which is, as several people have mentioned, the first attempt to get really good information about the nature and the scale of separation during emergencies. I think we've all realized as the project has progressed that it's not an easy task, and that the steps will be many and multifold. And so we've heard about some of the next steps, the development of the residential care tool. We're continuing to work on a projection tool that would allow us to have estimates at the very beginning of an emergency, or even to be able to project before one has happened. So I think we have reached the end of our time together and are not going to have enough time here to head into a richer discussion, but I think we can plan that for a future date, knowing that there is much more learning and much more work to be done. And we look forward to continuing to do this together. Thank you for joining us this morning, afternoon, or evening, depending on where you are in the world. And be on the lookout for more updates about the Measuring Separation in Emergencies project. Thank you, everyone.